Good day, everyone. This is Dr. Yakubu Ibrahim. Today, we want to talk about just a general overview of infertility. And the reason for this is that the month of June, it's Infertility Awareness Month. We want to just highlight a few things based on our clinical experience in the infertility field, what we see happening and all of that. So there are some very salient things we want to talk about, so that perhaps people will be assisted in their infertility or fertility journey to know when not to do what or when to do the right things. What we see happening is that a lot of time, more often than not, fertility or infertility seems to hit people by surprise, because there's always a general assumption that, well, when I'm ready to have my child, I won't have it after all. I'm clean and this and that. So because of this impression that whenever you're ready, you'll have a child, a lot of people leave that fertility, pursue other things in life, only to realize that whenever they are now ready, it is not as easy as they thought. And there is this misconception about the fertility assistance available, the so-called assisted reproductive technologies available in the world. People believe that, okay, even if I have a problem, provided there's a fertility clinic, there's a hospital or some fertility doctor somewhere, he or she will assist me to have a child. Unfortunately, that is not entirely true. That is also a myth. I always tell my patients sometimes that we have to understand that technology can never override biology. So sometimes the journey is complex, or is made complex because biological issues have complicated the life of the person to the extent that science cannot help you at that time. So at the end of the day, you find out that the available assisted reproductive techniques or technologies at the moment cannot help every person, every man or every woman with infertility. And so we need to know that, so that early enough, when it is necessary, we should start this journey. Except, of course, if we have resigned to fear and say, well, as it is, whether I have children in future or not, I don't have a problem. Or maybe I'm fine with adoption and the rest of it. It is important that we all avail ourselves with appropriate information that will help us to navigate the path smoothly. So by and large, infertility can affect both males and female. Before now, there's always this myth that it's only women that have infertility problems. But I know those who have gone through this process now know that yes, men can equally be as vulnerable as women when it comes to infertility issues. So please, it's important that every man, every woman, whoever intends to have children anytime in life, knows that this journey is better started early enough. When I mean early enough, well, of course, for men, there is a little advantage in the biology of men when it comes to fertility. And this little advantage is in the fact that men, for the whole period of their lifetime, have a potential to produce, to have a child, using their own semen or sperm. However, even at that, the older a man gets, the more damaged his sperm cells get, and the more likely that he may end up having a child with abnormalities. So that is a fact of science that everyone should know. The younger you are, the more likely that your cells are more viable and better, and chances of having abnormal babies is less. That is a universal truth. For women, unfortunately, there is age limit above which is naturally impossible so far to have a child or biological child of our own. And this age point is actually the age of menopause, which on the average is around 52, 51, in the 50s generally. Before then, every woman has the potential to have a child. Okay, but again, in the case of a woman, the earlier the journey started, when I mean early, there's an optimal reproductive age for a woman, and that optimal reproductive age is that age in her reproductive life when she has the greatest potential of having children or having babies with the least possible complications, and this is usually between the ages of 18 and 25. After that, well, your fertility potential will be declining as we go along, and more so after the age of 35 for a woman. There's a rapid decline in fertility potential of a woman after the age of 35. So therefore, it's very important that every woman has this in mind, at the back of her mind. Whatever it is you are doing, whatever plans you have for yourself in life, keep in mind that, well, with fertility potential is not entirely in your control, and you get to that point in life where the present or existing artificial reproductive technologies may not even be helpful to you, because the age, or rather the sun has set as far as the fertility reproductive bike is concerned. So by and large, we want to create this awareness. Everybody who desires to have a child, man or woman, at some point, it may not be a bad idea to once in a while check yourself. Okay, for a woman, okay, let me even see if I do my follicular, what does it look like? Do I have fibroids that may interfere with my fertility potential later? A simple scan will do that every now and then, And then, of course, for women in particular, it's difficult these days to settle down, as they call it. And so for women, sometimes there is this opportunity, there is this chance of preserving your eggs, if you are in places where that service is available. They can actually say freeze your eggs at some point for future use, because again, here in our practice, we see a lot of women coming around when they don't have any eggs anymore, to try to freeze their eggs when the eggs are already exhausted. So please, people should have all of these things in mind, and it's important that in these times, with the advent of the internet, you avail yourself with a lot of information that will help you make decisions on time, so that you are guided properly. You won't get to that point in life and then you look back and say, oh, how did I get here? I wish I had this information before now. So this is the whole essence of this talk, and we hope that this information will help people perhaps create greater awareness, so that people will take this part of their life seriously rather than putting it in the back. But thank you very much.